What if doing the right thing means breaking the rules? When does the greater good justify moral compromise? Today, we confront these dilemmas through the lens of act utilitarianism. Welcome back to Ethics and Action, where we dive into the philosophical theories that shape our moral decisions in everyday life. I'm your host, Munira Subah, and today we're tackling one of the most influential moral theories in ethics, act utilitarianism by Jeremy Bentham. To briefly introduce the theory, act utilitarianism argues that the rightness or wrongness of an action depends entirely on the consequences it produces. An act is moral if it brings about the greatest happiness for the greatest number of people. Simple in theory, but in practice, it can be far more complicated. Joining me today are five distinguished guests: a doctor, a psychologist, a lawyer, a teacher, and a police officer. We'll analyze how Bentham's theory applies to real-life moral dilemmas from the perspective of each profession. We'll also explore the central question: to what extent do humans need fixed moral rules, and when should we adapt our behavior based on context? We also have a roundabout debate in the case study of COVID-19. Let's start by unpacking the concept a little bit more. Bentham's act utilitarianism is based on his famous hedonic calculus, a way to measure pleasure and pain caused by any action. It's like a moral math problem. You add up the pleasure, subtract the pain, and the result should guide what we ought to do. But how does this play out in the real world? To help us explore that, let's begin with our first guest. Doctor, you work in emergency medicine. How does act utilitarianism apply to life or death decisions?
Thank you. Act utilitarianism, the idea that the right action produces the greatest good for the greatest number, is something we live with daily. Even if we don't live it that way, it's always present. During COVID-19, I had to decide who gets the last vitamin: a 90-year-old man with multiple conditions, or a 30-year-old single mother of two children. Her survival likely meant more future happiness for her children and also for her community.
Well, that's a heavy moral weight. Doesn't that risk discriminating based on age or perceived social value?
It does. That's what makes these decisions so difficult. It feels brutal to reduce our life or calculation. But in emergencies, especially mass casualty events, we can't treat every life as equal in outcome. We are not judging a person's worth. We are estimating the impact of survival. Bentham's principle pushes us to choose the action that brings the most moral well-being. It's logical, but it's not always emotionally satisfying, and it's rarely ethical.
So, do you ever feel torn between following hospital rules and then doing what feels right?
Constantly, guidelines are written for predictability and fairness, but real life rarely follows protocol. There are times when an older patient demands of my grandfather. I want to fight harder for them emotionally, but then I ask myself, if saving them means letting someone with better odds die, am I doing more harm than good? That's where act utilitarianism comes in. It helps me step back from emotional impulse and make decisions based on outcomes.
So, do you think utilitarianism gives enough moral clarity in medicine?
It's a double-edged sword. On one hand, utilitarianism gives clarity when chaos hits. It tells us to maximize life saved, reduce suffering, and increase future well-being. But it can lead to moral distress. I have had nights lying awake, questioning whether I truly made the right decision. Was I following reason, or did my own bias sneak in? Was it logic, or just fear of regret?
So you would say it's more of a decision-making tool than a moral compass.
Exactly. It's a tool, a structured way to make decisions, especially under pressure. But we are not machines. We carry pain, grief, and moral guilt. Act utilitarianism offers logic, but real life involves ethics, compassion, and sometimes knowing when to pause calculation, especially when a human face is right in front of you.
So is there a specific moment where that tension maybe really hit you?
Yes, during an earthquake relief we had limited antibiotics. I had to choose between a young boy with a severe infection and an older man in critical condition. The boy had a much higher chance of recovery, so I gave the antibiotics. Later, I learned the elderly man had just become a grandfather. It still was. But if we look at it through a utilitarian lens, maximizing survival, reducing long-term suffering, I still believe it was the right decision. That doesn't mean it was easy or painless.
That's really powerful, and it just shows that utilitarianism in medicine isn't just a theory; it's very personal.
It really is. It can help guide decisions, but it never erases the emotional burden of choosing one life over another.
Well, thank you, Dr. Ahmed. Now we're going to turn to Dr. Samira, our psychologist, on the panel. Welcome, Dr. Samira. I hope you're doing well. Utilitarianism values outcomes, measurable effects like life saves, harm reduce, etc. But mental well-being isn't so easily measured. So how does act utilitarianism play a part in your field?
That's a profound question, and it gets to the heart of one of the greatest tensions in mental health. Let me give you an example. Sometimes I have to recover involuntary commitment for a patient experiencing psychosis or suicidal ideation. They may beg to be left alone, they may feel violated, powerless, even betrayed. And yet I know that if I don't intervene, the risk of self-harm or even harm to others is high. From an utilitarian perspective, the decision is clear. Protect the greatest good by prioritizing safety. By emotionally, it's a gut-wrenching call.
Oh, so you're basically prioritizing short-term emotional distress for long-term societal and individual benefit?
Exactly. The patient suffers in the moment, confusion, fear, perhaps even trauma from being hospitalized against their will. But if the end result is that they live, stabilize, and return to their life with better coping tools, then in terms of total happiness and harm reduction, we have achieved net good. Act utilitarianism justifies that. It gives a framework for painful decisions.
I see, but doesn't that come dangerously close to justifying psychological harm in the name of greater utility?
That's the dark side we wrestle with. Utilitarian reasoning, particularly in its act-based form, can unintentionally flatten human experience into data points. The calculus tends to favor outcomes that are quantifiable, reduced suicide rates, fewer psychiatric emergencies, economic productivity. But emotional damage, especially internal trauma, is much harder to measure. And that's where utilitarianism can fall short. A patient might survive a suicidal episode but carry a lifetime of mistrust toward the mental health system. Was it worth it? The math says yes, but the human heart might say no.
I see. So, do you think Bentham's original model, like maximizing pleasure, minimizing pain, does it give enough moral weight to emotional and maybe psychological complexity?
Not entirely. Bentham's Hadley calculus, his attempts to quantify happiness doesn't translate ultimately. Emotions don't follow linear rules. Grief, for instance, can lead to growth. Trauma can foster resilience or it can completely devastate. And cultural factors complicate it further. What feels traumatic in one culture may feel therapeutic in another. Utilitarianism has a Western rationalist bias that ignores these layers of identity, history, and emotion.
That's a powerful critique. So, how do you, as a psychologist, balance utilitarian reasoning, maybe with compassion?
I try to use utilitarianism as a guide, not a mandate. For example, in key communities of psychology, we sometimes design interventions like mandatory reporting of abuse or structured rehabilitation programs that restrict freedom in the short term. Or if reason support this, we reduce future harm and improve long-term outcomes. But I always pair those decisions with an empathy check. Am I seeing the patient as a full person? Am I listening to what the person is in well-being? We can let the greater good become a reason to silence the suffering.
Yeah. So, can you recall a specific moment when utilitarianism maybe helped or hindered your decision making?
I remember one teen patient who was 16, diagnosed with bipolar disorder, brought in after a suicide attempt. His parents were desperate to have him institutionalized, but he begged not to go. He was articulate, deeply insightful, and terrified of being locked up. Utilitarian logic said that commit him. The risk of another attempt is too high, but something in his voice, his self-awareness made me pause. I worked out a compromise intensive outpatient therapy with daily check-ins. He stabilized, rebuilt trust with his family, and stayed out of inpatient care. I still think about the case. Utilitarianism gave me one answer, but listening deeply gave me another.
So the tension between measurable outcomes and emotional realities remains a constant in your work.
Constant and exhausting. Honestly, activism offers clarity, but it can feel emotionally blunt. We need it, especially for policies and large-scale interventions. But in a therapy room, with one human being across from you, sometimes dignity, narrative, and emotional safety matter more than the numbers. And that's where I diverge from strict utilitarianism, where I step into more relational and humanistic ethics.
That's beautifully said, Dr. Samira. You've shown us that even in ethical frameworks, there are spaces where logic must kneel to live experience.
Thank you. At the end of the day, our goal isn't just to save lives, it's to help people live with dignity and meaning, and sometimes that's beyond calculation.
Thank you. Welcome, Advocate Rawan. I hope you're doing well. The law values structure and consistency. How does utilitarianism, which focuses on outcomes, fit into that?
Well, it's a classic tension. The law is rule-based, but the theory asks whether breaking a rule might create more or good. Think of whistleblowers or civil rights leaders like Gandhi and Martin Luther King Jr. They broke laws, yet most agree they acted morally. Utilitarianism can justify such acts when the result is a greater public benefit.
But isn't that dangerous? Like, if everyone just breaks the laws for what they think is the greater good, then where's the line?
Well, that's the risk. Utilitarianism needs guardrails, rights, equality, due process. So it doesn't justify chaos or harm disguised as morality. It's a tool for reform, not an excuse for lawlessness.
I see. So can law and freedom really coexist then?
True freedom isn't absence of rules. It's the ability to live responsibly within a system. Traffic laws, for example, don't oppress us. They protect us. But laws must evolve. When a law causes more harm than good, utilitarian reasoning helps us see that it's time for a change.
I see. So have you ever applied that in your own practice?
Yes, I once defended a nurse who breached hospital policy to report abuse. She broke the rules but stopped harm. The court recognized her intent. That case reminded me law must serve humanity. Rules matter, but justice matters more.
That's a powerful reminder. Thank you so much, Dr. Rahman.
My pleasure. Law and morality must work together, not as rivals, but as partners in progress.
Now let's bring this conversation to education. So, Ms. Lena, I hope you're doing well. You shape young minds every day. How do you apply utilitarian thinking in your classroom?
Thank you. Education is full of ethical questions. We often talk about theories and rules, deadlines, prerequisites, attendance, but life doesn't always fit neatly into those boxes. I remember once allowing a student to submit an assignment then because her father had passed away and she was emotionally shattered. Technically, I broke the rule. Other students had to meet the same deadline, and some had their own struggles too. But in that moment, my stick was clear. Support and humanity over enforcing economy.
So you chose compassion over written rulings?
Yes, from an utilitarian point of view, the decision I made was very sense. Ben can say that the increase in happiness and emotional relief made the unfairness obey. The action helped her feel more stable and she kept doing well for the rest of the term. So overall, it brought the vision.
But was it fair to the other students?
Some students felt it was unfair and thought she was my favorite. That's the problem with utilitarianism. What helps one person might upset another. Is it right if most benefit but some feel hurt?
So utilitarianism may sometimes overlook those who fall through the cracks.
Exactly. There's a flaw in act utilitarianism. It focuses only on outcomes, not fairness. It can overlook the pain of few people. Berkeley's way of measuring happiness doesn't always fit real life situations. In a classroom with different three students, one doing for all doesn't always work.
Then how do you balance the rule following with doing what's morally right?
As a teacher, I focus on what with other students who and support the class. I balance rule with empathy, then utilitarianism, theoretics, and virtue ethics to consider compassion fair.
I see. So do you ever fear that too much flexibility undermines authority?
Sometimes, yes, but real authority comes in trust, not just following rules. When students see you are fair and human, they are more likely to respect your decision. For me, the right approach is being prepared, thoughtful, and focusing on both outcomes and values.
That's a powerful reminder. Teaching isn't just about knowledge, it's also about moral leadership.
Right.
Finally, let's turn into law enforcement. Officer Kabir, you operate in high-stakes situations where law, ethics, and life itself are on the line. How does act utilitarianism factor into your decisions?
Thank you so much. Policing means balancing rules and safety. In a hostage case, we might lie to the kidnapper to hide them. Lying is usually wrong, but if it saves time and lives, it's the right thing. Saving lives matter mostly in those moments.
Wait, so you're saying that lying becomes moral if it leads to saving lives?
Actually, yes. As utilitarianism says, saving many lives is more important than one person getting the truth. Bentham believes small harm like a lie is okay if it brings more. If it reduces pain or increases happiness, it's the right choice.
Okay, but that logic can be abused, can't it?
Well, exactly. If every officer breaks rules for the greater good, it can lead to abuse. That's why we need strong rules, body counts, and review boards to keep actions fair and based on facts, not personal bias.
So then, how do you personally know, whatever you're doing is morally right in those moments?
Well, it's a tough question. We can't just look at results, we have to think about our reasons. If the action fits and how it affects public trust, one line might save a life but damage trust for years. Bentham helps in emergencies, but real ethics moves beyond quick results.
So, do you think strict rules make it harder or maybe easier to act morally?
Well, rules give clarity, but sometimes they get in the way of doing what's right. If the rule says no talking, but talking can stop violence, I go with what causes the least harm. My guide is always what helps people the most and hurt them the least.
And so, what about freedom? How do officers maintain moral autonomy?
Real freedom is choosing to do what's right even when it's hard. When we must aim for justice, not just follow laws. Utilitarianism helps if we use it with care and kindness. Without that, it can do harm. With it, it leads to fair and human policing.
Thank you, Officer Kabir. You've truly shown that in high-stakes situations, morality often lives in. What a powerful discussion. We've seen how act utilitarianism offers a flexible, result-oriented moral compass, not without risk. It can justify harsh actions, blur ethical lines, and potentially ignore the rights of the few. Now we're going to move on to our next segment, the roundabout debate regarding utilitarianism in the pandemic world, and we're going to talk about the case study of COVID-19. Let's open the floor. The pandemic was a moment where the theory and practice collided. According to the Journal of Media Ethics, governments adopted utilitarian principles to justify everything from ventilator triage to lockdowns, all in the name of maximizing survival and minimizing harm. But at what cost?
Ethical, it was necessary, but brutal. I had to help decide who got treatment and who didn't. That's the purest form of act utilitarianism, save the most lives. But the emotional burden was staggering. I still remember a patient's daughter begging us not to let him die just because he was old. The BBC article calls these tragic choices. But what about the families who never got to say goodbye?
And those decisions triggered deep trauma. The article you referenced highlights the psychological harms of utilitarian policy. not just in patients but frontline workers. Isolation, grief, moral injury, we save lives but scared minds. Were those harms really accounted for? Studies now show PTSD rates spiked among healthcare workers forced to make those calls.
Let's not forget legality. Emergency laws permitted sweeping surveillance and restriction of movement, all justified by their logic. But who protected civil liberties? A democracy can thrive if public trust collapses. Once you normalize extreme measures, do they ever fully retreat?
Same with education. We close schools to protect physical health. But what about emotional and development harm to children? Poor kids fell behind me. The PMC article mentions is property unit suffering. Was it the greatest coup when millions lost last year of learning?
And we are enforcing rules we didn't believe, arresting vendors for violating curfews, reciting migrant workers from shelters. It felt wrong. The public saw us as enforcers of cruelty, not protectors. Utilitarianism didn't account for dignity. The PMC people calls this moral residue the lingering guilt when policies dehumanize.
So, what do we do when utilitarianism works but leaves moral damage in its wake?
We need safeguards. Medical ethics committees should include diverse voices, social workers, patient advocates, not just policy enforcers. The PMC article suggests tries transparency, but was there any?
Trauma informed care must also be part of ethical planning, maximize health without erasing mental well being. The article warns of secondary disasters, suicides, addiction crises. We ignored them.
Balance number with narratives. Behind every majority is a minority left behind. The PMC data shows kids in poverty lost 3x more learning. Was that minimized harm?
Ethics training must be continuous, not just in theory, but scenario based. Authority without reflection is dangerous. The PMC people calls for post crisis accountability. Did we get any?
We've heard from 5 different fields, 5 different lenses, but one common thread: the tension between doing what's right and doing what leads to the most good. Act utilitarianism gives us a clear formula: maximize happiness, minimize suffering. But our guests have shown real life isn't always the clear cut. Sometimes the numbers clash with our value. Sometimes compassion challenges calculation. So, should we always follow the utilitarian path? Or are there moments where principles must hold even when the cost is high? That's the ongoing debate and the one worth having. Thank you to all our guests for their honesty and insight. And thank you, dear listeners, for joining us in this ethical exploration. Until next time, I'm your host, Munira Subah, and this was Ethics in Action. Stay curious, stay compassionate, and keep asking the hard questions.